Hello, my name is Patrice, and I wanted to talk to you all today about something that I deal with I've dealt with for quite a long time in my life, at least the last 20 some odd years, and it's called migraines. I've had migraines since the age of 14, and I will be 40 in December of this year, so that's a pretty long time. But I wanted to share with you all the information that I did pull up on migraine. Okay. Migraine is a neurological syndrome characterized by altered bodily perceptions, severe headaches, and nausea. Psychologically, the migraine headache is a neurological condition more common to women than to men. There is a migraine pain center or generator in the brain. A migraine begins when hyperactive nerve cells send out impulses to the nerves, to the blood vessels, causing them to clamp down or constrict, followed by dilation or expanding, and the release of serotonin and other inflammatory substances that cause the pulsation to be very painful. The typical migraine headache is unilateral and pulsating, which lasts usually 4 to 72 hours. The exact cause of migraines are unknown, although they are related to changes in the brain as well as to genetic causes. There are migraine headache variants. Some originate in the brainstem, and some are genetically disposed. Studies of twins indicate a 60 to 65% genetic influence upon their ability to develop migraine headaches. Moreover, fluctuating hormone levels indicate a migraine relation. 75% of adult patients are women. Initial treatment is with angelics for the headache and antiemetic for the nausea and the avoidance of triggering conditions. The symptoms of a migraine headache include moderate to severe pain, often described as pounding, throbbing pain that can affect the whole head or can shift from one side of the head to the other. Sensitivity to light, noise, or odors, blurred vision, nausea or vomiting, stomach upset, abdominal pain, loss of appetite, sensations of being very warm or cool, paleness, fatigue, dizziness, bright flashing dots or lights, blind spots, wavy or jagged lines, and rarely fever. Triggers for migraine include the following: emotional stress, sensitivity to specific chemicals and preservatives in foods, caffeine, changing of the weather, menstrual periods, and we all know that's with women, not men, excessive fatigue, skipping meals, and changes in their normal sleep pattern. Also, there are some medical conditions that cause migraines as well, or they're associated with migraines. I'll say it like that. And those conditions are asthma, chronic fatigue syndrome, hypertension, stroke, and sleep disorders. There are many medical treatments for migraines. Migraines are treated in two different types of approaches: abortive and preventive. Let me go back and say there are two kinds of approaches, but there are many different types of medications, I should have said, that can help with migraines. Abortive is the goal of abortive therapy is to stop the migraine once it starts. The prescribed medications stop the migraine when one is coming on, or once it has begun, you may take it as needed. I've been on that medication myself, and it worked, but it was kind of had me jittery a lot because I had to take too much of it. To me, I could, and just real quick, what I had to do was take the medication. I would take it at the onset of the headache, and then I would take one for every hour up to 4 hours to stop it, and 9 times out of 10 it wouldn't even stop it. So but some of them work. That's just in my case. The medication they had me on didn't work. But anyway, they different names of medications that can be used or that are prescribed is Relpax, Frovia, Emerge, Maxalt, Zomig. There are also some over-the-counter medications that you can get, like Midrin, migrainal nasal spray. I've never tried the nasal spray before. Even Advil migraine, Excedrin migraine, which is the one that I use for mine. It really, really helps me real good. And Motrin migraine pain. Also, they give you medication for the nausea, which is called Regalan, Compazine, and I know a lot of the women um, well, a lot of people who've dealt with nausea, they have taken Phenergan. I know everybody talk about Phenergan. I remember the first time I took Phenergan, I was like, hey, I like this. But anyway, okay. Also, there is preventive medications that you can take. This treatment is used only if the migraines occur frequently, and that frequently means typically more than one per week. Sometimes I deal with that. It just depends on what things are going on in my life at that time. Medications used to treat blood pressure, high blood pressure, beta blockers, calcium channel blockers are used to help in preventing the migraines. Also, antidepressants and anti-seizure medications can be used. Alternative treatments for migraines and headaches include biofeedback, stress management, acupuncture, massage, herbs, essential oils, and dietary changes. Also, believe it or not, some of our favorite foods, chocolate, cheese, citrus fruit, red wine, can cause the headache. Different resources, different places, websites that you can go to find more information about migraines. The American Academy for Neurology, the American Academy for Neurology Foundation, the American Council for Headache Education, and the National Headache Foundation.